Classification of acetabular fractures divided into two categories: elementary fractures and associated fractures. Here's a brief explanation of each type. Elementary fractures. 1. Anterior wall, a fracture involving the front part of the acetabular wall. 2. Anterior column, a fracture involving the front part of the acetabulum extending into the iliac wing. 3. Transverse, a horizontal fracture dividing the acetabulum into superior and inferior parts. 4. Posterior wall, a fracture involving the back part of the acetabular wall. 5. Posterior column, a fracture involving the back part of the acetabulum extending into the ischium. Associated fractures. 1. Both columns, fractures involving both the anterior and posterior columns of the acetabulum. 2. Posterior column with posterior wall, a fracture that includes both the posterior column and the posterior wall. 3. Anterior column with posterior hemitransverse, a fracture involving the anterior column with a partial transverse fracture extending to the posterior column. 4. T-shaped, a fracture that creates a T-shape involving both columns and transverse elements. 5. Transverse with posterior wall, a transverse fracture that also involves the posterior wall. These classifications are important for determining the appropriate treatment and surgical approach for acetabular fractures.